Hi, my name is Molly. I am 27 years old and I have a condition called Usher Syndrome. Live in the UK, southeast, in a town called Maidenhead. I personally, so I've been deaf my whole life, wearing hearing aids. I've always been a very visual person. So the first things I started to notice was struggling to lip read, which as a deaf person was kind of like my mode of communication. I would read people's lips. So once I started to struggle to lip read, I struggled to read the board in the classroom. I was a bit clumsier. And I experienced lots of headaches, and it was my teacher of the deaf at the time who said, "Oh, Molly, you might need reading glasses." We weren't particularly worried at this point because we were told that it's not uncommon for deaf children and adults to be experiencing such exhaustion, because it is tiring being deaf and, you know, taking everything in visually. It wasn't unusual for a deaf child to wear glasses or anything like that. So we were, guided by that. So we went for a routine eye check, and then that's obviously when it confirmed our worst nightmare, really. But yeah, no, the ocular experiences were just that, clumsiness, unable to lip read. And I would go as far to say now, looking back in hindsight, that the night blindness started a lot earlier on, because I've always hated the dark. And I hated school discos, I hated Halloween, I would do anything to avoid them. But again, what child does like the dark? This was never something that we questioned. But yes, so on that standpoint though, now that we know I have Usher syndrome, and that one of the first symptoms of retinitis pigmentosa is night blindness, I would say that started quite early on. So I found this question quite an interesting one. I'd never heard that reference before. So I did really have to think about it. But I think for me, my experience was slightly different in some respect, because obviously the optician picked it up quite early on. I was 11, almost 12. I was quite oblivious to the whole thing. I think I was very much used to going to appointments and having lots of adult attention because of my deafness. I never really viewed it as something particularly unusual. It didn't really appear strange to me for a while, and it actually wasn't until a couple of years down the line, when I'd obviously lost a lot more of my vision, that I started asking more questions. And I discovered that I kind of referred to it as an eye condition, but I never really understood the severity of it. I just knew there was something not quite right, but it is what it is. And I noticed as I was asking more questions, my mum was finding it harder to answer them. And when I got to 14 or 15, I lost the majority of my vision by the age of 14. So I went from being partially sighted to severely sight impaired, blind at the age of 14. So obviously I lost quite a lot. And that's when I was asking more questions. And I remember mum struggling to answer them. And then she sort of said the words Usher syndrome. And again, they didn't really mean much to me because I'd never heard of it. And that was when I Googled it. And it was the first time I saw the word blind. It never really struck me how serious it really was. From a parent perspective, I don't want to, shun my mum here. My parents really struggled, because I was one of 4 kids, and it was a case of, how do you tell your daughter that she's going blind and we can't help it, sort of thing. So I think they really needed to take the time to wrap their heads around it before they could talk to me about it. And then, like mum would say, that she had ways of telling me, she had planned how she was going to tell me, but it never turned out the way she envisions. I think because I wasn't told till later on, and I'd lost a lot of my vision, it then was a fair few years after that I really started to accept it. I was very much in denial for a very, very long time because I could get away with it. I could get away with seeing a little bit and hearing a little bit, but it wasn't the safest. I started to notice society treated me differently if I was holding my cane, or if I was out with a guide dog, asking for help when I look normal, quotation marks. It's a lot of tricky lessons to learn quite early on in your life. I would say there was a great deal of denial. I really struggled with my mental health. I had depression, anxiety for a long time, and still to this day, is something that doesn't go away. Looking back, I think we really overlooked the fact that I was a teenager. I was only a teenager and I was hormonal and I was at school and I just wanted to be like my friends. If we maybe focus on that a little bit more over the diagnosis, then maybe things would be different. But I think because Usher syndrome and deafblindness were thrown in my face all the time, I would do anything to not think about that, and so that led me to denial, and a fair few years of sort of very, very dark years. Yeah, so I talk about how lucky I was a lot, because a lot of people have question marks over the Usher syndrome diagnosis for a really long time, because people don't know what they're looking at. But my optician, just in our local Vision Express here in the UK, just so happened to be reading up on Usher syndrome, and he had asked my parents, "Do you know why Molly is deaf?" And they had said, "Well, no, it was a technical blip. We were just told it happens sometimes. There's no family history, none of that." So the fact that he knew, something must have clicked in his mind, thought this patient is deaf as well, let's just check some other things out to rule it out. Then that's something, particularly like Specsavers here in the UK, they now provide hearing aids as well as glasses. I always think they should really be aware of Usher syndrome, because obviously if they're offering both hearing devices as well as glasses, it would be good to be aware of some of the early onset symptoms, and it would save a lot of time and stress on the family when it comes to support, particularly if you're a child and you're in education. It is so hard trying to get appropriate support that can help you thrive as an individual. So if you don't, then that really hinders your mental health further. You're excluded from friendship groups, from society, from getting a job. It's just a knock-on effect. Yeah, I'm really quite fortunate, because the optician knew, he had heard of, or he had been reading, and he knew enough. And I'm not expecting people to be experts, but just to know, to ask the right questions. Oh, my patient's deaf as well, let's just check a couple of more things out, just to be safe. And I don't think that's a lot to ask. I think if you're an optician, it's very likely you'll come across a lot of deaf people. There's no reason why you shouldn't cover all bases. So no, I'm not being treated. I'm involved in a lot of research and stuff. I always put my name down for everything. I'm at this point where I don't really have a lot to lose. I've donated my skin to Maria Mutaji over in Moorfield Eye Hospital. They've got zebrafish and they've got a bit of everything in her lab, and they've been doing all sorts, which has been really, really exciting. But they've been able to create a replicate of my retina using my skin sample, and so they're studying that, and I'm soon gonna go and visit my retina to see it. But yeah, no, so I've never sort of shied away from any opportunities, or if it's of any help to researchers or educators, I'm always quite keen to be a part of things. But there's nothing currently ongoing But yeah, I try to stay in the loop as much as I can, but I don't let it overrule my life, because obviously I do just need to live my life, and just hope for the best that one day something's going to come along and help us all out. So I have 5 degrees vision left. So I mentioned a moment ago, I lost the majority of my vision very early on with my Usher syndrome, which is, I'm told, it's a bit more rare because I have Usher type 2, and normally it's kind of adolescence, late 20s, early 30s. That's what I was told. I wouldn't lose a lot of my vision until I was in my late 20s, early 30s. However, I went from being partially sighted at 12 to severely sight impaired, politically correct for blind at 14. Yeah, so I sort of have quite a small window. My left eye's pretty much had it, so I rely mainly on my right eye. Can't see a thing in the dark. Struggle a lot in bright light and glare as well. The winter months are pretty hard here in the UK. Now the sun's a lot lower and it's darker all the time. So it's normally the time of year us people with RP and Usher syndrome hibernate for a few months, because it's just not much fun being out and about. My vision has progressed quite a bit. Touch wood, it's been fairly stable the past few years. So one would like to think that the damage has been done, if you like, and that I'm going to keep what I have. But that's the cruel thing with Usher syndrome. There's no way of knowing. I try to be optimistic. I think, as I just said, I try not to, hold my breath or, constantly research and look at things online daily or weekly, because if you do that, it controls your life and you can very quickly fall into a rabbit hole over it. I always stay optimistic for future generations. Obviously, it'd be amazing if something was to come by in my generation to at least stabilize. And of course, if it was to improve vision, then that would be an absolute bonus. But something that could come along and just freeze what I've got, so then I don't have to be worried about, oh, what if I lose more? What if I can't see my children grow up? And, things like that, that often get me sad. Yeah, I try to remain positive. There's no reason why it shouldn't be, because there's so much going on, particularly since I've been diagnosed. I'm 27 now, so it's been a long old time. There's been so much more happening in the sector in the last sort of 3 or 4 years, which has been really, really exciting for us as a family to see. Because when I was first diagnosed, there really wasn't a lot. So just based on that, I do feel fairly positive. I'm also kind of hesitant because I don't want to be too positive and get too excited.